Okay, I'm going to get us started and introduce our guest speaker. I'm very excited to introduce Dr. Jay Chakraborty, who is a professor and Mellichamp Endowed Chair in Racial Environmental Justice at the Bren School of Environmental Science and Management at UC Santa Barbara. He has a Ph.D. in Geography and M.S. in Urban and Regional Planning, both from the University of Iowa. His research activities encompass a wide array of concerns, which you're going to hear about today, from the human dimensions of climate and environmental change, with an emphasis on environmental justice and social vulnerability to hazards and disasters. So join me in welcoming Dr. Chakraborty.
Yeah, thanks for the introduction. Good afternoon, everyone. Thank you for coming here today in person or joining us virtually. And thanks for inviting me to your seminar and giving me opportunity to talk about social vulnerability to climate-related hazards, which is kind of the title of my talk. Also, one of the most kind of prominent themes in my research and scholarship in the last decade and a half or so. And I thought here for my talk today, I will focus on case studies that I have been involved with in the last 10, almost 12 years now in the states of Florida and Texas before I moved to California about a year and a half ago in fall of 2024. So in terms of this presentation, you can think of this as a tale of three projects, all of which were funded by the U.S. National Science Foundation, or NSF. And this was during the good old days when federal agencies such as the NSF are still funding research on racial and social inequities related to climate change, which unfortunately no longer the case based on my recent experiences. But I digress. So all of these three projects are a little different in scope and purpose, but they're kind of connected to that broader theme of assessing or measuring social vulnerability to climate-related hazards. And I thought I would discuss them in chronological order, starting with the first and earliest project, which actually began more than 12 years ago, which was sponsored by the NSF IME program, which has, I think it still has, I guess, a strong engineering focus. But this was one of the first large multi-year projects they supported that had a social science, or I should say social equity kind of component. And I thought I'll also use this project to introduce some theoretical concepts, or at least conceptual elements that has guided or informed my subsequent work and projects, including the two specific projects that followed, this large one that I'll discuss more in the second half of my presentation. So let me begin with a little bit of background. And this is about the framework of environmental justice research, or EJ research, which some of you may or may not have come across before. And the idea here is that a lot of quantitative studies in the last 2-3 decades or even longer has focused on analyzing whether racial, ethnic minorities, lower income individuals, and other vulnerable and marginalized groups are unequally exposed to or unfairly impacted by hazards and risks. And although the initial focus of this work and the environmental justice movement, I guess, in the US was on hazardous waste and air pollution, the devastation caused by Hurricane Katrina, its uneven impacts and government failures in responding to the disaster kind of prompted academic researchers and those involved in, EJ advocates and activism to, think more deeply about unequal impacts caused by geophysical events, such as hurricanes and floods at that time, and kind of expand this distributive EJ framework to consider natural disasters such as flooding. So our premise of this project was that although EJ research has produced important knowledge regarding various pollution sources and more anthropogenic hazards, there are certain limitations that constrain our understanding of the social implications of natural hazards, or specifically flooding. So when we reviewed this literature that existed almost 10 years ago at that time, we found that previous EJ studies have yielded inconsistent or divergent findings regarding the relationship between social vulnerability and flooding. especially when we compared studies that had focused on pre-flood risks to those that examine the impacts of actual flood events. So again, in terms of how this is done, the most common approach to analyzing the social impacts of flooding is to just look at the social or demographic characteristics of those who live in floodable zones or floodplains to those outside, kind of direct comparison. And so most of these quantitative studies in the US have found socially advantaged people or those of lower social vulnerability to experience higher pre-event exposure to flood hazards, which kind of contradicts the traditional expectation of environmental injustice, if you think about it that way. On the other hand, you have more, I would say, numerous and methodologically diverse studies of flood impacts, response, and post-event recovery. They have found socially disadvantaged individuals and communities to suffer the worst impacts. And this is a function of their increased exposure to flooding during the actual event, also their limited access to protective resources. So from a traditional EJ perspective, which supports the expectation that socially vulnerable groups experience higher hazard exposure, it was kind of difficult to reconcile these opposite or divergent fundings when we compared pre-flood to post-flood studies that had been conducted at that point. And so basically, to expand knowledge of the EJ implications of flooding, it was important to recognize, we thought, three limitations that we tried to address through this project. And number one was this incomplete conception of risk as high hazard exposure, which neglects people's different capacities to cope with or reduce risks. And number two was this underlying assumption that people always seek to avoid hazards when selecting home locations, which neglects other factors influencing decision-making, such as locational benefits that may be derived by staying or moving to a certain place. And number three, a nearly exclusive focus, which was kind of common at that time, on focusing on a single type of hazard in a single study area, which makes generalizations about contexts and hazards, kind of difficult and complicated. So the next few slides, I will focus on how we try to address these limitations and kind of use them to expand the traditional EJ framework to better account for these divergent results between, as I mentioned, pre-flood versus post-flood studies. And with reference to limitation one, in order to broaden this traditional EJ conception of risk, it was useful, we thought, to borrow concepts from studies that have been conducted on social vulnerability to hazards and disasters. And what we found, or what I learned, is that the social vulnerability to disasters and environmental justice research are kind of topically similar or connected, but conceptually they are quite different, or at least very distinct. So a theoretical premise of vulnerability studies, now referred to as vulnerability science, is that risk is determined partly by human exposure to a hazard and partly by people's social vulnerability. Now, social vulnerability is an interesting term. There are many definitions, there are many debates on exactly what it means, but I thought I'll use this definition from Benjamin Weisner's book that I found really useful at that time. It still applies to most of the work I'm working, a lot of the projects I'm working on currently. So, which is what you see on this slide. So the idea that risk is shaped partly by social vulnerability factors that affect people's capacities to mitigate risk is an improvement on how it had been conceived or defined in the EJ literature at that time. And remember, the EJ conception of risk supports the expectation that most disadvantaged groups of society inhabit the most hazardous locations, a pattern that I said before did not align with the results of those pre-flood studies in terms of who were living in areas at flood risk or floodable zones. So the second limitation is this one-dimensional treatment of the environment as hazard. In other words, environmental justice scholars have focused mainly on the negative environmental attributes, and even those that have looked at positive attributes, such as access to urban green space or access to employment opportunities, they have not really examined the trade-offs, between positive and negative, between the risks and benefits of living in a specific location, something we are trying to address. And this is interesting because I found that at that time that locational benefits connected to hazards have been studied more extensively in other fields. So for example, you have the psychometric risk perception literature reveals that decisions about where to live are influenced by the trade-off between perceived risks and benefits, people will tend to tolerate or accept higher levels of hazard exposure in places where the benefits are high based on factors like scenic views or social exclusion, etc. And even economic studies have explored these relationships and found that proximity to shorelines or coastlines are highly desirable in residential land markets because of many positive amenities they offer, like ocean views and beach access, etc. So we developed this conceptual model to address these divergent findings from prior studies in the case of hazards that do offer high locational benefits. At the same time, we wanted to address, what I have called here limitation number 3, at least I called that a few slides ago, the lack of comparative knowledge regarding how relationships vary across hazard characteristics and geographic context. And one specific characteristics that we felt was very important here, both theoretically and of course empirically, is this idea of divisibility. And this refers to the ability to separate, geographically speaking, the risks and benefits that are connected to a hazard. And we found that this concept has not been really studied or at least integrated in both social vulnerability to disasters and EJ literatures, a gap that we wanted to address by putting together this conceptual model. So our starting point with the model was this diagram, which shows the traditional EJ conception, in which people with high social vulnerability live in places with high hazard exposure. But remember, as I said before, this doesn't account for the divisibility of risks and benefits or people's different capacities to mitigate risks. And again, issues that we tried to overcome by comparing air pollution with coastal flood hazards. Okay, so this figure shows an example where risks and benefits are highly divisible as they are in case of exposure to a large stationary pollution source. Could be a hazardous waste landfill or industrial manufacturing plant that generates air or water pollution. So in the case of a major factory, as I said, that releases air pollutants or pollutes local water bodies, nearby residents may be at risk and not really or truly benefiting from by living near the hazardous or polluting factory, which implies a high degree of divisibility between risks and benefits. Now, for these hazards where risks and benefits are highly divisible, nearby locations tend to be less desirable places to live, tend to have lower property values, lower rents, lower housing costs in general. So this often leads to a concentration or overrepresentation of socially vulnerable or lower income residents, and who really don't have the political power or capacities for mitigating. That's why it says low mitigation, for mitigating the negative attributes or high hazard exposure. And this figure, the second one, shows an example where risks are not clearly divisible from the benefits, as with coastal flood zones or coastal flood risk. To optimize or to maximize beach access and ocean views from the home, a household must tolerate the risk to flooding or areas, or even if they're residing in areas with high flood exposure. And typically, in most urban areas, these high-risk places attract higher income or economically affluent households seeking the coastal amenities who represent low social vulnerability. And these higher income or low social vulnerability residents with low social vulnerability of these coastal areas, they have the resources, they can afford the resources to protect themselves and also take advantage of other forms of mitigation to reduce the risks and enjoy the benefits of coastal living. So this is a figure, it looks a bit complicated, but it combines the three previous diagrams that you just saw and summarizes our complete conceptual model of the relationship between social vulnerability and hazard exposure, while accounting for divisibility of risks and benefits. Now, the complicated part was, how to test this model empirically in the real world. So we tried to do that in terms of, testing this model and validating, the conceptual framework. We did that by conducting case studies on the social implications of flood risk and air pollution exposure in Miami or Houston, the two largest coastal metro areas of the US South. I think they still are. So that's still relevant today. So in terms of our methodology, we kind of use a comparative approach and relied on both quantitative and qualitative, I guess now we refer to it as a mixed methods kind of methodological framework. So we had quantitative analysis of secondary data from federal sources like the EPA and FEMA, also primary structured survey data in combination with semi-structured interview data. And for these structured surveys, we actually partnered with a professional survey research firm and used random digit dialing of mainly landline phone numbers, because this was like more than 10 years ago. And we conducted these phone surveys in both English and Spanish, and each survey was about 30 minutes long. And we also used kind of a multi-stage sampling approach to make sure that our sample of households was representative of the two metro areas, both spatially and socially. And we ended up about 600 completed surveys, 1,200 total, in each metro area. Now, in terms of results, I'll focus on these studies of flood hazards in Miami and Houston that our research team published. And the underlying names represent our grad student assistants who did really outstanding work, co-authored several articles with us, also wrote their thesis and dissertations on these topics. Now, I'm focusing mainly on flooding here today, but the comparison between flood risks and air pollution is very important to the conceptual model, which you just saw, because they have different divisibility ideas attached to them. So I'll also refer to results from these papers that focused on air pollution in both Miami and Houston. So let me start my discussion of results with two maps that show the FEMA or federally designated flood zones in the two metro areas. And this distinction between coastal and inland flood risk was very important to our analysis of the role of divisibility, which I'll get to in a few minutes. But both these urban areas, and some of you may know this already, have been impacted before our project and even after the project ended by a number of tropical storms and flood events. And they're also very diverse in terms of race, ethnicity, and socioeconomic status. So making them ideal study areas for any work on environmental justice, distributive justice, or social vulnerability. Now, going straight to my summary of the results, in Metro Miami, we found that socially vulnerable groups such as Black, Hispanic, and also low-income households were less likely to live in areas with high flood risk, but significantly more likely to reside in neighborhoods with high air pollution exposure. Again, that opposite of divergent relationships didn't match or align with our conceptual model. And the statistical evidence also suggested that this divergence in results was related to the low divisibility of locational benefits within coastal flood zones. So this became very clear when the 100-year flood zones were separated or disaggregated based on their coastal versus inland designation. Indicators of coastal or water-based amenities showed highly positive relationship with coastal flood risk. But if you look at the other flood zones, those are more inland, which don't have those similar positive amenities like ocean views or beach access, etc., which lack the water-based amenities of coastal zones. They had very high social vulnerability, again, mostly minority and people in poverty, which actually matched the traditional EJ or distributive environmental justice expectations. So in terms of implications for injustice, while the entire metro area in Miami faced very high flood risk in general, the fact that the most advantaged, or I should say economically affluent people reside in areas at greatest risk to flooding suggested that the positive attributes kind of outweigh the negative attributes, or amenities kind of outweigh the flood risk cost. And what's interesting here is that socially advantaged groups in Miami, which is mainly non-Hispanic, white, and very high-income households, they were able to externalize the cost of coastal living through insurance coverage offered by the NFIP, which provided, or still does, highly subsidized premiums to residents in these coastal flood zones. So higher income or affluent residents of Metro Miami choose to live in coastal areas because the flood risks are mitigated through a variety of public investments and mitigation resources. And also, I should also add that many coastal residents who responded to a survey lived in high-rise condos, which offer kind of vertical protection, because most of the flood damage occurs at the ground level, at the lower level. So our results did align with our conceptual models, since it suggests that flood insurance subsidization inflates property values and encourages risk-taking behavior, especially for higher income or upper class households and white households in Miami who seek these coastal amenities and can externalize, I think, the cost associated with that. So our studies in the greater Houston metro area provided a good comparison or contrast with in terms of generalizing our conceptual model. Here we found that the results correspond with the traditional injustice expectations of greater social vulnerability or a significant higher percentage of minorities and people in poverty in both types of neighborhoods, those with higher exposure to air pollution and flood risk. And so why do our EJ or social vulnerability results diverge between Miami and Houston? I think the best explanation is the dramatic difference in the role of water or water-based amenities in shaping residential patterns and residential growth. Although Houston is also adjacent to the coast, unlike Miami, residential settlement is not structured by water-based amenities. The major activity, or at least major economic activity that takes place along the Texas Gulf Coast that some of you may know already, are linked to the petrochemical industrial complex, one of the largest in the world and a major source of pollution. So coastal areas in Metro Houston, not desirable places to live, provide very few positive amenities because of these highly hazardous petrochemical industries. And these neighborhoods tend to be inhabited by more socially vulnerable and lower income people who face very high risks, not just from flooding, but also from pollution in the form of chronic emissions and accidental releases from these industries that occur very frequently, more frequently than they should. So how are the results similar? In both metro areas, socially vulnerable residents experience high exposure to flood risk, especially in inland flood zones in both Miami and Houston, which is of serious concern because they already have limited capacity to prepare or cope with or recover from inland flooding. So just to wrap up what we found in this project, environmental injustices appear to be produced and reproduced as socially advantaged or economically affluent residents seek to kind of monopolize access to all the coastal amenities, and added costs of flood risk mitigation are treated as kind of as an externality that is passed on to others in the metro area. And in metro area, floodable areas tend to be characterized not by water-based amenities, but by petrochemical industrial risk. As a result, socially vulnerable and low-income groups in particular have tended to live or been forced to live in areas with high flood risk. And in both metro areas, we found socially vulnerable residents have largely been confined to residing in neighborhoods that don't have adequate infrastructure, that are exposed to both natural disasters, pollution risks, and are less able to access protective resources or even enjoy any coastal amenity for sure. So overall, our results kind of highlighted the need to consider the multi-dimensional character of flood-prone areas, and it needed more investigation on the trade-offs, right? The concept of divisibility definitely was valid in terms of the evidence we found here. And of course, it called for more detailed investigation of the role of divisibility instead of the one-dimensional treatment that I said before. But what's interesting here is that about 2 months after we completed this project, I remember submitting the final report to the NSF in the summer of 2017, when as soon as we completed this project, this happened. And some of you may remember this event or read or heard about it before. So Harvey made landfall on the Texas Gulf Coast as a Category 4 storm. And after the initial landfall, the storm kind of lingered over the greater Houston MSA in that 10-county area that you saw on the previous map for almost seven to 8 days, which resulted in record amounts of rainfall, flooding, and a wide range of damages. I think it turned out to be the second costliest natural disaster in U.S. history. And what's interesting is that the list of people affected also included the 600 randomly chosen households which had just participated about 2 or 3 years ago in our survey on air pollution and flood risk, that I just presented from the previous project. And also interesting here is that, reports indicated that a very small fraction, less than 20%, actually about 17% of impacted residents had purchased flood insurance, but yet disparities in flood exposure and impacts were largely ignored in the initial headlines and media reports, both locally and nationally, including the major TV networks kind of focused on how it's on framing this as an equal opportunity disaster, or which means impacts were distributed equally, did not spare anyone, regardless of race, class, and other indicators of vulnerability. So that got me a little not outraged, I said, yeah, it did, but yeah, this enraged or encouraged me, I should say, to put together, well, I guess another grant proposal to seek funding for and receive a rapid response grant from the NSF Ph.D program. I guess this was a time when they're still supporting work on racial or social disparities. But our main goal of this project was to look at whether this was truly an equal opportunity disaster as claimed by the media and other reports, in terms of looking at social disparities in flood exposure, negative experiences, and the other impacts. And our main data source for estimating Harvey-related flooding was this complex digital product that was initially compiled by engineers in FEMA Region 6, kind of a grid-based data set that was based on high watermarks collected first by the U.S. Geological Survey, then confirmed with several local and even private sector sources. So we are able to obtain this GIS-based raster data set that contained flood depth values in feet as an attribute of each grid pixel, I guess, at very high 3 meter by 3 meter resolution. It did take us a while to clean up the data set, remove all permanent or other water bodies not relevant to Harvey, and ensure that it provides accurate estimates of only Harvey-induced flooding at that resolution. Really grateful to the 4 grad student assistants who spent many hours and helped us with this work. And we followed this up with another bilingual survey administered online as well as via landline and cell phones, which became more common at that time. And this was done only about 4 months after the disaster. And I've seen that's kind of the optimal period that helps us minimize any recall biases in terms of the negative experiences and impacts. So my next set of slides will cover 4 of the articles we published from this project. So just an overview mainly. So for our first study, which actually was published in the American Journal of Public Health, we estimated flood extent at the neighborhood or census tract level using the Harvey footprint and compared this to multiple socio-demographic variables from the latest ACS. And we also included social deprivation that by combining 5 economic status variables relevant to this area using principal component analysis. And then we use multivariate models that account for spatial clustering and several contextual factors, and found very strong evidence of distributive injustice in the sense that flood extent significantly greater in tracts with a higher percentage of non-Hispanic, Black, and Hispanic residents, as well as those with higher socioeconomic deprivation based on our index. And then we kind of conducted a similar study using primary household level data instead of tract level ACS data. And this was based on our sample of households that participated in our previous project, who had filled out the survey 3 years ago, and also had not moved when Harvey happened. So that was a smaller subset of the 600. And in this case, our dependent variable was the extent of flooding within 100 meters of each respondent's home. And we were able to use several, because it was based on primary data, we could use variables from the previous survey as independent and control variables. But very strong evidence, again, that flood extent was significantly greater for minority and lower income households who had participated in our previous survey. And our next paper focused on this concept of unmet needs that were measured using the CDC's CASPR protocol. And for those who have never heard of this before, this is a methodology that was developed and recommended by the World Health Organization for post-disaster analysis. And we tried to operationalize this by using responses to 11 items from our survey. Not a complete match, but close enough, I guess, to look at this in detail. And we found that respondents experienced an average of 3 of these 11 unmet needs. Any guesses what was number 1? Yeah, go ahead. Exactly, that's the correct answer. Very nice. So going without electricity was number 1. I think 44% of respondents said that, followed by money for living expenses and then adequate transportation. And again, statistical models indicated not an equal opportunity disaster, significant racial disparities and economic disparities. But we also found foreign-born Hispanics without US citizenship more likely to suffer from higher number of unmet needs and other negative experiences. This was an important finding because citizenship is an eligibility requirement for disaster assistance programs, right, from government sources. So those who are not US citizens are miss out on those opportunities for disaster funding. And also Hispanic non-citizens tend to have lower English language proficiency, making it difficult to fill out forms and paperwork for disaster assistance, which I thought was interesting for this project. Again, not an equal opportunity disaster. And the last paper I want to talk about from this project focused on this concept of looking at people with disabilities. Again, a group that I found had largely been ignored in previous studies of environmental justice or flooding or even disaster vulnerability in general. So we found, again, we didn't have survey questions on disability, which I now regret, but we went back to census tract level ACS data, and we found that the extent of flooding was significant, again, going back based on the Harvey footprint, 3-meter resolution aggregated to tracts, significantly greater in neighborhoods with a higher percentage of civilian disabled individuals. And when we broke the disability category by 6 types of difficulty used by even the census definition of disability status, we found those with cognitive, 2 of them, cognitive and ambulatory difficulties to face significantly higher exposure to Harvey flooding. So obviously, these results clearly suggested the need to include the disabled more explicitly in future research, as well as disaster planning and management. And what's interesting is that when I looked at some of the manuals and documents related to disaster planning in the state of Texas, they did not make a distinction between types of disability, which was disturbing. And hopefully that's an omission that should be addressed because there are differences. Should not be treated as a single homogeneous category. Okay, so just a quick overview in terms of the implications of this work. Another interesting thing we found that FEMA or federally designated flood zones that are commonly used for disaster planning, preparation, management, they tend to overlook certain areas that also get flooded heavily after storms like Harvey. We found that many neighborhoods affected by Harvey flooding, where socially vulnerable groups are overrepresented, are located outside the 100-year floodplain or flood zone. So more equitable flood protection requires more accurate flood risk maps and models, which could be based on actual post-flood, watermarks or measurements like we were able to do for this project. But now you also have emerging data sets like the First Street Foundation's, flood model that provides flood risk estimates at very high resolution. And some of them also allow us to separate flood risk from, rain, stream flow, storm surges, et cetera, which would be the way to go in the future. So, and I also wanted to point out one of the things we found, of course, many of you know that frequency and intensity of Harvey-type events are going to increase in the future. They are increasing. But I think post-disaster needs assessment and preparation need to think beyond, what kind of vulnerability indicators we include. A lot of these marginalized and underserved groups, I mentioned disability, non-citizens, those with limited language skills, they have to be also included in protocols like CASPER and other, disaster planning and management strategies that are being developed to, resolve some of these issues. Okay, so moving on now to the third and latest project that focuses on the Texas winter storm, now referred to as Uri. And this is an interesting winter storm that included 3 Arctic fronts that swept across the state of Texas, and almost 75% of the counties faced record low temperatures that they had never experienced before. And then the largest electric grid operator, ERCOT, lost control of the power supply serving most of Texas. More than 5 million customers were affected. And almost all major metro areas of Texas were affected, except El Paso, where I used to live and work at that time. It was outside the ERCOT grid area. But again, a very high percentage of people everywhere lost electricity, and almost half went without pipe water at some point during the storm. And for this project, we tried to frame it as using this evolving or newly emerging concept of cascading disaster, and which I found was an understudied topic in the literature on disaster vulnerability and climate change in general. So think of this as an extreme event in which interaction between hazards, social vulnerabilities, and infrastructure systems generate highly unexpected secondary events. The classic one thing leads to another, right? And has very strong subsequent impacts. So in this case, we had record low temperatures that had never happened before, combining with service disruptions, both power and water, illness and health problems, infrastructure damage due to freezing, and carbon monoxide poisoning from those who use their cars in their garages to heat their homes. And service disruptions also led to food shortages and other challenges. And it also coincided with the pandemic to worsen the cascading impacts. And many of you remember that in early 2021, COVID-19 was still a major public health crisis, and distribution of the first vaccine dose had just started. So this also disrupted the deployment of more than 400,000 vaccinations of the first dose, I guess as used to call it at the time. So, and I also found that limited prior research has been done on how disaster cascade and what it means in terms of social inequalities and health disparities. So to address this gap, we conducted a household level survey, now via cell phone only. Times have changed since 10 years ago. And again, 4 to 5 months after the winter storm, to randomly selected adults in the 8 largest metro area of Texas that are shown on this map. And we also included, for comparison purposes, those who lived outside the ERCOT grid area, like El Paso County, Texas, to allow for more effective comparisons. So my next set of slides will quickly cover the 3 articles from this work that have been published recently and what we found there. We first look at disparities in service disruptions. Again, something that had not been done before, at least not systematically in the disaster literature that came before this. And we used, again, multivariate models that account for spatial clustering within each of the 8 metro areas, and also relevant control variables that describe household or individual characteristics. And our comparisons are based on adjusted means for each category. But we found that the adjusted mean length of power outages for non-Hispanic Black households was 53.2 hours. And why is that important? Is it exceeds the 48-hour deadline or 48-hour window recommended by the CDC, during which refrigerated food would become, would remain safe or edible, right? So, and this adjusted mean higher than 48 was much lower than 48. It was only 35.8 for white house, non-Hispanic white households. Similar disparities for households with children and renters compared to their counterpart groups. And finally, significantly longer pipe water outages also for non-Hispanic Black versus white respondents, almost 1.5 times higher, as you can see here. And we also examined how households with disabled individuals were impacted, as well as how disability status can interact with your housing status to worsen some of these impacts. And again, for this study, we used a wide range of negative impacts that are listed here on the right. And again, we use multivariate models that control for race, income, age, housing tenure, gender, and other relevant factors. But regardless of all of that, households with disabled persons were more negatively and severely impacted in terms of, this time on this survey, I did include disability-related variables, which I did not do after the Harvey project. So I think the only variable where no significant differences were observed between disabled versus non-disabled was children's school cancellation. Otherwise, for all of these specific experiences, there were differences. And we also found residents in subsidized rental housing resulted in significantly longer water advisories, power outages, slower recovery, self-reported recovery levels, and a higher number of many of these experiences. So for households with a disabled person who also lived in public housing or federally subsidized housing during the storm, there was kind of a double jeopardy because one thing combining with the other. And finally, we focused on mental health disparities. Again, another understudied topic in research on cascading disasters as well as cold weather events in general. So our focus was mainly on PTS, which was measured by combining responses to 6 survey questions derived from a post-traumatic checklist known as PCL-6 that's used, I found out, extensively in public health. And again, we found interesting results in terms of racial differences, higher odds for PTS for households with disabled members compared to other households. And we also tried to look at the effect of cascades by combining it with COVID-related questions to create these 2 categories, high and low COVID impact, but found higher odds of PTS for those with higher COVID impact. So overall, a very strong evidence of adverse cascading effects. PTS more likely if respondents had a water or power outage and high COVID impact, and also if they had both water and power outages and high COVID-19 impact. So this work, I should point out, still continues. I mean, the analysis survey data is still ongoing. We did apply for an extension in December 2024. Terrible timing, which was not granted. But I think we have enough information to continue working on other studies from this work. And we already have very strong evidence of disparities, which I did not expect in service outages and many different unequal impacts, health impacts also, especially for those who are minority and disabled specifically. So of course, these disparities highlight the need to formulate plans, policies, interventions. I've listed here, I won't go through the whole list, some of the policy implications that we reported from this work in various papers, especially in Texas. Many of them are relevant to Texas, definitely. Outdated and inadequate infrastructure. And also many of the respondents complained about timely communication about when services will be restored and how to stay safe both after and during these events. So, and not just the communication, but in languages and platforms that are accessible to a wider range of vulnerable groups. And a lot of them are linked to injustices from the past in terms of disinvestment in neighborhoods and racist practices. But also, to me, the new thing that we found, and we want to do a little bit more work using variables that focus on, I mentioned PTS, but anxiety and depression also. I think we need to do more work to understand the unequal mental health impacts of some of these extreme weather events, and which all need multi-sector efforts. And especially what we found links more to minority status and disability status, but definitely there are other things that need to be done on that on this note as well. Yeah, I'm running out of time, so I'm going to stop here. And just a quick note of thanks to two colleagues at the University of my collaborators, I guess, who are involved in all three projects that I presented here today. And thank you all for staying awake and listening to me for the last 40 minutes or so.